Master Namaskarams to your lotus feet. నాలోన కలవెల్గున పరిసరముల వారి రూపమున కనపట్టుగాక నాయుచరించడి నాదమా వెల్గుగా వినిపించి కనిపించి వెలయుగాక నాలోన వెలుపల ఏలు నిశ్శబ్దంబు ప్రేమగా సాక్షాత్కరించుగాక మా కంఠ శబ్దాల చీకట్లు వెల్గుగా కరగించి అది మమ్ము కలుపుగాక తెలివికి ని సద్గుణముల బలము గూర్చి నా ప్రణాళిక విశ్వ ప్రణాళిక గను వ్యాప్తమై విశ్వమూర్తి రూపంబునందు నిలుచుగావుత శాశ్వత నిలయమగుచు. నమస్కారం మాస్టర్ ఈకే. Good morning to everybody. In the previous class, you learned about some useful drugs to treat the patients who are suffering with animal and insect bites. Today, we will proceed further and try to learn a new topic by name dysentery. Listen to me carefully. Dysentery. Whenever persons suffering from myalgias take polluted water, they suffer from severe headache, loss of mucus in stools, and loss of blood along with this mucus. This disease is called dysentery. It is cured when an indicated homeopathic remedy is applied after careful selection by compiling the totality of symptoms. Any one of the following remedies will be useful for patients suffering from dysentery. Aloes, severe stomachache around the navel, greenish mucus in stools, loss of blood in mucus and weakness will be present in patients requiring aloes. Stomachache relieves after motion. If the patient delays after getting the sensation, motion passes immediately in clothes. Stool passes involuntarily when the patient sneezes, coughs, or laughs. There will be insecurity in the rectum. 1 dose of aloes 30c shall be given when indicated. If required, a second dose of aloes 30c can be given after 6 hours. Aloes 200c can also be given as per the necessity. The next useful drug is Nux Vomica. Severe stomachache, lack of appetite, weight and heaviness of stomach, and scanty mucus in stools indicate Nux Vomica. The patient feels as if part of the stool is unexpelled. He will have frequent ineffectual desire, but passes small quantities at each attempt. Hence, feels incomplete and unsatisfactory. When indicated, Nux Vomica 30c should be given as the remedy. A second dose of Nux Vomica 30c can be given if required. after 4 hours. If stomachache is not relieved and still there is an urge for stool and is unsatisfactory, 1 dose of Nux Vomica 200c should be given. After that, lecithin 6c should be given as follow-up twice a day for 3 or 4 days. Mercur, stomachache, gripping pain around the navel, loss of taste, loss of more blood in stool than mucus, overheat in body, or fever indicate this remedy. Tenesmus is not relieved by stool. When these symptoms are present, Mercur 6c shall be given thrice a day for 2 or 3 days. If there is fever below 1 or 2 degrees Fahrenheit, 1 dose of Mercur 30c should be given as the remedy. If fever is more than 1 or 2 degrees Fahrenheit, Mercur 200c should be given. From the next day onwards, Ferrum Phos 6x should be given as follow-up twice a day for 4 or 5 days. Merxal, stomachache, loss of more mucus than blood in stool, loss of taste, brown coated tongue, increased secretion of saliva, sore mouth, and teeth imprinted tongue characterize Merxal. In some patients, blood streaks appear in stool along with mucus. In some other patients, only mucus is present in stools and there will be no indication of loss of blood. In some patients, there may be excessive sweating at times. When indicated, Merxal 6c should be given as the remedy thrice a day. If there is relief, 2 doses of Merxal 6c should be given the next day and 1 dose on the 3rd day. This will cure the patient. From the next day onwards, Ferrum Phos 6x should be given twice a day for 3 or 4 days as the follow-up. When the patient has more nausea and intense stomachache and stabbing pain, 1 dose of Merxal 30c should be given as the remedy. Calimur 6x should be given as the follow-up twice a day for 3 or 4 days. The next useful drug is Argentinitricum. There is stitching pain around the navel, trembling and throbbing in stomach. The patient feels anxiety and tension as and when it pains in stomach and rushes to the closet. Stool is noisy, flatulent, and green, sherry mucus with much distension of the abdomen. When these symptoms are present, 1 dose of Argentinitricum 6c should be given thrice a day for 1 or 2 days. If there is intense nausea in stomach, along with much anxiety, 1 dose of Argentine nitricum 200C shall be given as the remedy. From the next day onwards, Kali Mur-6X shall be given as follow-up twice a day for 3 or 4 days. Croton take, mild stomach ache, copious watery stools always, forcibly shot out, stool with greenish slime, often offensive and pasty, as that of a cock, indicate this remedy. When indicated, 1 dose of Croton 30C should be given as the remedy. From the next day onwards, Kali Mur-6X shall be given as the follow-up twice a day for 3 or 4 days. Pulsatilla. When pulsatilla is required, there will be pain in stomach, mucus in stools, and no 2 stools are alike. In some patients, stools appear as a mixture of different colors. Lips, tongue, and throat get dried up and thirstlessness runs. Though the patient is not thirsty, he craves for cool drinks. When these symptoms are present, Pulsatilla 6C should be given thrice a day for 2 or 3 days. If required, Pulsatilla 30C can also be given. From the next day onwards, Kali Mur-6X shall be given as the follow-up twice a day for 3 or 4 days. Opium, stomachache, loss of more blood than mucus in stools, no other suffering during evacuation, warm sweats all over the body, indicate opium. The patient will become drowsy and have stupid sleep. When indicated, 1 dose of opium 30C should be given as the remedy. From the next day onwards, Ferrum Phos 6X shall be given as the follow-up twice a day for 3 or 4 days. Food suggested for patients suffering from dysentery. 1. Salty, chilly, and sour foods must be avoided. 2. Rice with fresh buttermilk should be given. 3. Tender coconut water, fresh buttermilk can be taken. 4. Sapota fruit and banana can be given. 5. Salty, chilly, and sour foods must be avoided for 2 or 3 days after dysentery is cured, and easily digestible foods must be taken. Swasti.